In the fourth section, now we will talk about the carcinoid syndromes. What's the pathobiology of the carcinoid syndrome? What are the different types of carcinoid syndrome? What is carcinoid crisis? And what are the associated heart diseases with the carcinoid syndrome? So carcinoid syndrome is the syndrome which is associated with the features like flushing and diarrhea. You can see very bad flushing and redness. Deep red erythema of upper body is present in carcinoid syndrome. There is pruritus, itching, and steatorrhea. Lacrimation and salivation. Lacrimation, patient is staring and there is excessive production of saliva. Facial edema and abdominal pain. Hypotension and diaphoresis. Fibrotic plaques in endometrium. Valvular constriction and tricuspid insufficiency. So these are the features associated with carcinoid syndrome, and it also affects the heart. There is decreased blood pressure, there is endometrium, fibrotic plaques are present, constriction of the valves, and tricuspid insufficiency is associated. So these are the features of carcinoid syndrome. Other features, there is pulmonary insufficiency and stenosis. Cardiac lesions are present. Mitral valve is affected. Wheezing or asthma-like symptoms. Pellagra-like skin lesions. Urethral obstruction. Peyronie's penis disease. Intra-abdominal fibrosis and occlusion of mesenteric artery or veins. So these are all the features associated with carcinoid syndrome. It is a serious condition because besides the features like flushing, diarrhea, salivation, lacrimation, which are not as damaging, it has features like involvement of the heart, involvement of the mitral valve, tricuspid insufficiency, pulmonary insufficiency, and stenosis, and they are all very serious features associated with carcinoid syndrome. Pathobiology of carcinoid syndrome occurs products secreted by the tumor reach circulation. So pathobiology, once these products which are secreted by the tumors reach the circulation, then it produces different systemic effects. We mentioned different peptides produced by the tumors. Primary neuroendocrine tumors, usually they have nodal metastasis, extensive retroperitoneal invasion, carcinoid syndrome without hepatic metastasis. Major secretory product is serotonin. Functions of serotonin: synthesized from tryptophan, 5-hydroxytryptophan 3 and 4 receptors. Stimulating intestinal secretions, then we have inhibition of absorption, increase the intestinal motility, stimulates fibrogenesis, and it is responsible for diarrhea. So the functions of serotonin are it increase or stimulate the secretion of intestine, inhibit the absorption. So secretions are increased and the absorption is decreased. It increases the motility and responsible for the diarrhea. Histamine and serotonin leads to wheezing, fibrosis, and then also Peyronie's disease. So these are the features associated with serotonin and histamine. Tachykinins, these are all the pathobiological changes we are discussing that occur as a result of the secretions once they reach the circulation. So we discussed about serotonin, next is tachykinins. Also responsible for diarrhea, stored in gastrointestinal neuroendocrine tumors, released during flushing. So flushing is caused by tachykinins, or flushing releases tachykinins, and there is octreotide prevents the release. So if we need to prevent the release, it's by the octreotide, and these tachykinins are released when there is flushing present. Some associated heart diseases with the carcinoid syndrome, central role of serotonin in associated heart diseases, higher plasma level of neurokinin A, substance P and ANP, pro-brain natriuretic peptide, chemogranin A and activin A, and higher urinary 5-hydroxyindole acetic acid. So these are the substances which are increased in the plasma, which are associated with the heart disease, but the main role in that is of serotonin. Valvulopathic drugs induces mitogenesis, activate 5-HT2B, upregulation of TGF beta tumor growth factor, collagen synthesis, and valvular changes mediated by increased serotonin. So these are the drugs that brings about the changes in the valves, collagen synthesis, TGF upregulation, and then activate 5-hydroxytryptamine T2B. Typical and atypical carcinoid syndrome. Now we went over all the features associated with the carcinoid syndrome. Now what's the difference between typical and atypical carcinoid syndrome? Typical form is due to midgut neuroendocrine tumors. We know that the midgut is the most common site of the neuroendocrine tumor. So this is typical form is due to midgut involvement. 5-HTP is to 5-HT. Small amount converted to 5-HIAA, and then expanded serotonin pool. So in typical form, we have 5-hydroxytryptamine to 5-hydroxytryptamine HTP. Small amount is converted to 5-hydroxyindole acetic acid, and there is expanded serotonin pool. This is the typical form of carcinoid syndrome. Then atypical form is due to deficiency of dopa decarboxylase, no conversion of 5-hydroxytryptamine, and then in foregut carcinoid usually this is present. The serotonin is normal, and urinary 5-HTP and 5-HT is increased. So that's the difference between typical and atypical. In one, serotonin is more, in one it's normal, one is in the midgut, one is in the foreguts carcinoid. Carcinoid crisis. Patients develop flushing, diarrhea, abdominal pain, cardiac abnormalities, severe diarrhea, severe flushing, and there is very bad pain. Now the patient is in the carcinoid crisis, which is provoked by anesthesia, chemotherapy, surgery, biopsy, endoscopy, radiologic examinations, vessel catheterization, stress, and procedures mild as repeated palpation of tumor. All these are the factors that can lead to carcinoid crisis, that is a serious condition. So that was all about the carcinoid syndrome. Thank you for watching sqadia.com.